morning to one and all present out here. On behalf of the Kidney Warrior Foundation and Nephropolis, I take great pleasure to welcome each one of you who's seated in front of the dais. Today is indeed a very, very special day for each one of us in the patient community and, of course, in the medical fraternity as well, because we are here to discuss a topic which we believe is the need of the hour: the growing rate of chronic kidney disease in the country and, in fact, in the whole world. And it takes such a great pride and honor to introduce our special guest who's made it this morning in spite of their busy schedules. May I request you all in the audience to kindly put your hands together to welcome our special guest this morning, Mr. D. Randeep, IAS Commissioner, Health and Family Welfare, Government of Karnataka. On behalf of both the Kidney Warrior Foundation and Nephropolis, thank you so much, sir, for joining us. Of course, our chief guest this morning, the finest nephrologist in Bangalore, Dr. Gurudev, the President, Ramaya Memorial Hospital, to please join us on the dais. May I take the privilege to welcome the President, IMA, Mr. Dr. Venugopal. Thank you so much, sir, for joining us today, in spite of your busy schedule. We also have with us the two doctors who are heading our projects. Please put your hands together and welcome one of the most renowned nephrologists in Bangalore, in Karnataka, and I would say across the country. Somebody who's been the backbone to the Kidney Warrior Foundation. In fact, the two doctors to follow are both such important people to the patient fraternity. Please welcome Dr. Sundar Sankaran, currently at Aster Whitefield Hospital. And our very dearest Dr. Arvind Kanchi, who has also been such a backbone to the community, head of department in a couple of hospitals, which include the Bangalore Hospital, Trustwell Hospital. May I request you to please give a big hand of applause to our special guests seated on this dais this morning. May I also take the privilege to welcome the founder, director, Kidney Warrior Foundation, a lady who needs no much introduction to this audience. Please welcome Mrs. Vasundhara Raghavan on stage. I thought it'll be nice to have a lady on the dais among the gentlemen. That was just a sudden add-on. May I request our dignitaries to join us for the lighting of the lamp?
गणाध्यक्षाय धीमहि गुणशरीराय गुणमण्डिताय गुणेशानाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि.
Thank you very much, sir, and respected doctors for doing the honors, for lighting up the lamp and beginning this occasion with the blessings of the Almighty. Before we proceed further, we'd like the audience to know that the task force is an initiative by the Kidney Warrior Foundation. We started off, we aim to have various different task forces, and the first task force that we started off is the preventive measures in the country. And this task force for preventive measures is headed by Dr. Sundar and Dr. Arvind Kanchi, who's seated on the dais. So on behalf of Kidney Warrior Foundation, thank you very much, doctors. We're now going to request our chief guest to talk on the theme that we are presenting today, preventive measures and the need of the hour for the growing rate of chronic kidney disease in the country. But before we request our chief guest, Dr. Gurudev, to come forward, I'm going to request his close friend, Dr. Sundar, to please introduce him.
Thank you, Marian. To introduce Gurudev, we require Wikipedia or encyclopedia, but nevertheless, as Marian said, he is a close friend of mine. We know him for nearly 4 decades. Gurudev did his MBBS from Mysore Medical College, then MD Medicine from Davangere, and then he got trained in nephrology with one of the, I would say, the doyen of nephrology, the father of nephrology in India, Dr. M.K. Mani. And now currently he heads the Ramaya Hospital, the president of the Ramaya Hospital. Before that, he was in Mysore. He was the professor head of nephrology in JSS Medical College, and then joined Vikram Hospital. In fact, he is, I would say, in those days when I came to Bangalore in the 80s, nephrology was centered only in Bangalore. And Gurudev was probably the first nephrologist to do transplant outside of Bangalore, in Mysore, and which is something, now we have got transplant going on everywhere. Recently we had a cadaver transplant, AB incompatible transplant in Hubli. I mean, these are trendsetters, but at that point of time, Gurudev to do something beyond Bangalore is something unique. One thing with Gurudev is, he's a no-nonsense guy. He's very frank. He will tell you what is honest. You may not like it at that time. Sometimes he's told me so many things. I used to get angry with him. But later on, you realize what he said is actually good for you and good for everybody. And he joined Ramaya Medical College in 2012. And he actually moved in because I would say he's a women's lip person. He moved in for his wife's career. His wife was an entrepreneur. She was actually driving every day from Mysore to Bangalore. Then we suggested, Gurudev, why don't you shift and change your job to Bangalore? And there was a vacancy in Ramaya Hospital. He joined as the professor head. And he did a lot of work in COVID. And that is the reason he has been elevated to the post of president of Ramaya Hospital. And he's doing a lot of good work. And he also is very active in our association. In fact, any problem we have in the association, which is whether it's political or non-political or dealing with patients, we always talk to him, and he gives us frank advice how to go about it. So it's indeed a great honor to have Dr. Gurudev, Professor Gurudev here with us to inaugurate this program and also talk a few words on prevention of CKD, because prevention, I think, is more important than treatment. I don't think in a country like America can afford to treat all the patients with ASRD. So I think prevention is important. I request Gurudev to be with us. Incidentally, Gurudev has recently become a grandfather of, I welcome to the grandfather club because I have 4 grandkids myself. And I keep saying this too often. We should have some way where you can become grandfather without becoming father. Then it's easy, you know. So nevertheless, Gurudev, I request you to say a few words and inaugurate our program. Thank you for being with us. Thank you.
Good morning to the dignitaries of the dais and my dear colleagues. I find there is an advantage of having your own friend introduce you. You can only talk good, at least in public. Thanks, Sundar, for all that introduction. You have to take it with a pinch of salt, what Sundar says. As Sundar said, the initial days of nephrology, when I graduated and came, it was Sundar who prompted me to go to Mysore. He said, we are already 7 of us are there in Bangalore. There is nobody else in Karnataka outside Bangalore. Why don't you think of going to Mysore? Because that was my, actually I was already working in JSS as a lecturer in medicine. So that prompted me to go back to Mysore because I had given a word also that I'll come back and start nephrology services in that part of the state. In fact, I happened to be the only nephrologist in Karnataka outside Bangalore those days. And I had to cater to 5 districts in that neighboring districts, Chamarajanagar, Mandya, Madikeri, as Hassan and even Chikmagalur. All the patients from there used to come only to Mysore for renal care. It was tough in the sense first to make my own colleagues understand about renal disease. First couple of months I didn't see a single patient in my hospital, and few patients whom I saw, they were sent from my hospital to Bangalore, and Sundar and colleagues referred them back to me to my hospital again. that was the way I started seeing patients. And I had few interesting things that happened. In there was one resident who was working with me. Now he's one of the very famous nephrologists in South India. He was my student, and then he joined as a resident. So I asked him, are there not any renal patients in our ICU at least? He said, yes, sir, there is one acute gastroenteritis with severe renal failure. I asked, Professor, shall I refer the case to the nephrologist? He said, it's acute kidney injury, he is going to recover, why do you need a nephrologist? Then there was one CKD patient, uremic encephalopathy, 200 urea, 17 creatinine. He asked, shall I refer this case? It's a CKD, anyhow is going to die, why do you want to call a nephrologist? So either way, I was not called to see a renal case. So it required a lot of education to our own colleagues first. But it so happened that we being very few, handful in those days, we got so immersed in treating patients who already had renal disease. So it became more of a curative nephrology what we were practicing than prevent. Neither we had the time, nor I'm sure Sundar will agree, those days we didn't have the inclination to look at preventive nephrology. You know, in India we have a huge gap between who have and who have nots. So one who can afford healthcare, sky is the limit for them, and there are 1,000 times more numbers who can't afford anything. So we have to look at preventive nephrology, though we started thinking about it when we started aging, but because of our work pressure that we had, I used to start my work at 7:30 in the morning and reach home only by 11 in the night. I never saw my children grow up. I never saw them when they crawled, when they started walking. When I left home, they were sleeping. When I came back, they were already asleep. So that was the pressure of work that we had. So we really had no time to concentrate on preventive nephrology. It's not an exaggeration. I have never slept for longer than 20 minutes in the night. Every 20-25 minutes, I was woken up for some call in some hospital in Mysore. That was the work that was there, the requirement of a nephrologist to take care of renal. I was happy at the end of 6 months that I could make people start referring to me when the creatinine was 1.4. Earlier, I was wondering why this guy with 6 is not even been asked, but I was happy that that much of education happened among the doctors. So we have to ask few questions when it comes to preventive nephrology. Is the disease common in our society? Yes. The common cause for end-stage renal disease or CKD in our country is diabetes and hypertension, and we have plenty of them. The 10% of the population is likely to have chronic kidney disease in this country. So we have plenty of patients who are going to suffer from CKD. Then we ask another question, is the intervention going to help? Definitely, there are a lot of proof. My own mentor, Dr. Mani, when he demonstrated that when they brought down the systolic BP by just 10 millimeters from what it was, he showed that the reaching end stage renal disease was postponed by 4 to 5 years. That was a huge benefit just by bringing down by 10 millimeters of Hg. Then, can these diseases be detected? I'm sure all of you know, one hemoglobin, one urine examination, one creatinine can detect most of the kidney diseases in our country. So it's very easy to detect also. Can it be prevented? I'll tell you how it can be prevented, how it has been shown with authority, with authentication, with solid data to back up. And how is it cost effective? Yes, it's so cost effective to screen these patients and also to prevent the complications. So having said all this, that I was fortunate to work under Padma Bhushan Dr. M.K. Mani, as Dr. Sundar mentioned, a pioneer in the field of nephrology. He started a program called Kidney Help Trust in late 80s and 90s. he adopted one village of a population in Tamil Nadu, 21,000 and odd people, and another village which didn't opt for his method of screening and treating. So what he did is he employed 10th passed or failed girls and boys, trained them how to check blood pressure, how to check urine for sugar. So from a newborn to the oldest in the society were screened every month after month for 20 long years. And what did he do? All those who had proteinuria and all that, every month a doctor went to the village, he sat with a white coat under a tree or in a temple or in a school, and he examined all those patients who were screened and found to have some abnormality. So he could detect early kidney disease in the form of proteinuria or blood sugar. So what he did is he used the cheapest possible medication. Like, I don't know, many of you might not have heard about Adalfin Acidrex. SKF used to manufacture this. It used to cost only 3 paise to control the blood pressure. Since it was so cheap, SKF stopped manufacturing it. Dr. Mani went to the court and got an ordered SKF to start manufacturing Adalfin Acidrex. Then he used the cheapest oral anti-diabetic drug to treat all the diabetic patients. So having done this, what did he find at the end of 10 years? I had no time to talk to him last night, otherwise he would have given me the latest figures. At the end of 10 years, he found that he delayed chronic renal disease in 17 out of 1,000 population, which amounted to about 60% of the people at risk. And his aim was to see that the patients don't get chronic kidney disease. But in the bargain, he found that the heart attacks came down by 30% in that village compared to the other village we didn't opt, which he used as a control. And he found that the strokes came down by 25%. And when he published this data in American Society of Nephrology, it was considered as a position paper, and it was circulated to every delegate in International Society of Nephrology. And it said this is the only way we can bring down kidney disease in the society. That is by screening them periodically from birth till the end. That's what he proposed. I have heard him speak to various government people in various forums. In fact, in one of the conference in Pondicherry, the President of India was there, 5 union ministers and 4 state ministers. He presented his data. He pressurized them, said it should be included made as like in our malaria eradication program, like our TB eradication program. Similarly, we should have eradication of CKD by making it a national program, by early detection. From the school itself, one has to start looking for kidney disease. A simple urine test will tell us whether he has got microscopic hematuria or a proteinuria, which can detect. Like in Canada, I think it's a part of their school health checkup. Every child has to go through urine examination to detect early kidney disease. So everybody agreed when he made a presentation, but 10 days back when we met, last month in February, Bangalore, he came down when I met. He said there has been zero effect of his presentations made again and again over 2 decades. So now that we have our health commissioner, I think, sir, you can make it possible. It is so simple. You can just browse Dr. M.K. Mani Kidney Prevention. You will get complete data. How simple it is and how easily we can prevent a dreaded disease like CKD. The another thing Dr. Mani did, which none of us didn't think that it was so important, was use of ACAs and ARBs in prevention of progression of CKD. People could recognize who is the doctor by looking at the prescription, because he was the only one who showed the ARB and ACI's dosage for control of hypertension is different from what we use for prevention of progression of CKD. I have seen his patients who are on 300 milligrams of enalapril, somebody who is on 240 milligrams of ARBs, Nobody has heard of this dosage. But now International Society of Nephrology come up and said, this is the way to prevent progression of CKD. So with his study, he has found that he postponed the end-stage renal disease by 15 years in diabetics. Somebody would have gone into renal failure after 5 years of detection, they were still holding on at the end of 25 years. What a wonderful thing. I mean, any number of, we are very proud to say, okay, my transplant patients are there still 25 years. One of my patients completed 28 years just last week. And she never, after 8th day of discharge, she has never got admitted to the hospital. She just comes every month for checkup. COVID taught all the patients and also doctors that it's not necessary to come every month. So they have started coming once in 3 months. It's unfortunate that she has outlived her donor. Her younger brother who donated died of CS stomach 12 years back, but she's going very strong. That's fine. Somebody who has reached end stage, that's okay. But every time when I completed my 100 transplant, I called my boss and said, sir, I finished 100 transplant. Very good to hear that. What have you done to prevent it? Then when I finished 200 transplant, I called him, sir, I finished 200. Good to know that. What have you done to prevent it? So when I said I have completed 300, he didn't say good, he said, you have not answered my question. So he lost complete interest in curative nephrology. He says, today we have to do preventive nephrology. So thanks for inviting me to say a few words and share my mentor's thoughts. Sir, you have to do something about this. It's a passionate appeal by nephrology community that we have to introduce preventive nephrology. It should become a national program. It should be part of every doctor's priority to see that everybody goes through a renal checkup. And there are methods to prevent the progression. Earlier, we didn't have the answer. How could I prevent it? Sundar knows, we did a transplant for one, Dr. Shivram. He was a most elite person, most educated. The first time he came to me in Mysore, now he has had a transplant 22 years back, he's doing extremely well though, but first time he came to me with 17 creatinine. A guy who used to teach students every day. Last day when his colleagues found that he was falling asleep in the middle of board meeting, then they said something is wrong with you, why don't you get a blood pressure checked? His blood pressure was 240 by 150. Then somebody said do a creatinine, it was 17. He said this must be wrong, doctor. I said no. Then he had a transplant. He came to Bangalore and had a transplant. So the ignorance is there. At least now, we don't see patients coming with end-stage renal disease for the first time, though occasional patient does drop in like that. But earlier days, most of our patients who required dialysis had the first consultation when they had severe renal failure. If only we had done the testing much earlier, maybe we could have postponed the eventuality. Thanks again, ma'am, for calling me, and my dear friend Sundar for proposing my name to inaugurate this program, and all of you having come on a Sunday morning. I was telling Sundar it is very easy to get the speakers, but difficult to get the audience. I was telling Maitri that once I was called by an IMA to a meeting to give a lecture. So it was at 7:30. I was traveling from, I said, okay, it was in Mandya. I said, okay, let me finish the talk and go to Bangalore for a weekend. So I took my wife and 2 children also. I said 7 o'clock, by 8 I'll be back in the car, we'll go. So it was 7, 8, 9, 10. The organizers kept, sir, 10 ನಿಮಿಷ ಬಂದ್ಬಿಡ್ತಾ ಇರತ್ತೆ. So when I started my talk, it was 11:15 in the night. Then there were only 4 people. I said, I can get 3 more audience. I pulled my family and I lectured them. So that their anger would come down. I don't know, I think they got more angry after listening to me. Thank you very much.